Our next restraint position will be lateral recumbency, also called the cat stretch. This will enable us to palpate the abdomen as well as allow another technician or a doctor to perform a cystocentesis in addition to the capability of transitioning into our Saphenous venipuncture. So what you need to do first is control the scruff. This time you will want your thumb facing cranially toward the head. You will use your back arm to grab the back legs. You want to make sure and have a finger in between the two hocks as to not knock them together and hurt the pet. Once you transition them to their side, you will pull the legs caudally as far as possible and rest your forearm directly behind the spine. This will allow for a solid surface for your other technician or a doctor to palpate against, as well as keeps the pet a little bit straighter for your procedure that is going to be completed. Now we're going to transition into the medial Saphenous venipuncture. All that you need to do, use your back hand. You want to position it like a blade, so flatten it out. Push the top leg back toward the abdomen and tuck the tail underneath as well. And then you karate chop down on the bottom leg that is touching the table. When you're doing this, you want to ensure that you push as far into the abdomen and the inguinal area as possible so that the venipuncturist can have as much leg to work with to draw blood from. And that is how you transition your pet into a lateral recumbency or cat stretch and then transition into your Saphenous venipuncture.